Ever wonder what causes asthma? Well, it's a complex question with no single answer. Asthma is a chronic disease impacting millions around the globe. It's a condition that doesn't discriminate, striking both young and old, regardless of where they live or their lifestyle. Understanding this disease, its origins, common symptoms, and how it's diagnosed is vital. It's a journey that begins with a single step, and that first step is knowledge. So buckle up and stay tuned as we delve into the causes of asthma. So, what exactly causes asthma? Dive into the world of asthma, and you'll find a complex interplay of factors that contribute to this condition. It's not a one-cause-fits-all scenario. Rather, it's a combination of environmental factors and genetics that set the stage for asthma. Let's start with environmental factors. Picture your lungs as a bustling city. Now imagine allergens such as pollen, dust mites, and pet dander as unwelcome visitors. They barge into the city, causing chaos, and your body responds with a defensive mechanism: inflammation. This inflammation narrows the airways, leading to the telltale symptoms of asthma. But the list of unwanted visitors doesn't end with allergens. Air pollution, including secondhand smoke and chemical fumes, can also act as triggers. Even a simple cold or respiratory infection can tip the scales and cause an asthma attack. Moving on to genetics. Just like your eye color or height, your likelihood of developing asthma can be inherited. If asthma runs in your family, your genetic makeup might make you more susceptible to this condition. But remember, asthma is like a puzzle, and these pieces, genetics and environment, need to fit together. You might have the genetic predisposition, but without the environmental trigger, asthma might remain dormant. Conversely, you might be exposed to environmental triggers, but without the genetic susceptibility, you might never develop asthma. To get a better understanding of these intricate mechanisms, we've sought insights from pulmonologists, the doctors who specialize in conditions of the respiratory system. They emphasize that while we have a good understanding of what causes asthma, each person's asthma is unique. What triggers an attack in one individual might not affect another at all. So, in essence, the causes of asthma are as diverse as the people it affects. A complex tapestry of genetics, environment, and individual triggers, all intertwining to create a condition that impacts millions worldwide. Now that we understand the causes, let's identify the symptoms of asthma. Do you know how to recognize the signs of asthma? Asthma, a chronic lung condition, can manifest in a variety of ways. It's important to note that the symptoms can range from mild to severe and may not be the same for everyone. But there are a few telltale signs that are commonly associated with asthma. Let's start with shortness of breath. People with asthma often describe this as a feeling of not getting enough air into their lungs. It's like trying to breathe through a straw. It's hard, it's uncomfortable, and it can even be scary. Next on the list is wheezing. This is a whistling or squeaky sound that happens when you breathe. It's particularly noticeable when exhaling and is caused by the airways becoming narrow and inflamed. Coughing is another common symptom, especially at night or early in the morning. It's a dry, hacking cough that just doesn't seem to go away. It can be triggered by exposure to cold air, exercise, or even laughter. And then there's the feeling of chest tightness. This can feel like a band is being tightened around your chest, making it difficult to breathe. This symptom often accompanies the other symptoms we've mentioned. Now, let's talk about real-world experiences. Meet John. He's a teacher, a football coach, and he also has asthma. He describes his asthma symptoms as a combination of all these signs: the shortness of breath, the wheezing, the coughing, and the chest tightness. They all come together to form a symphony of discomfort that he's learned to manage over the years. Remember, these symptoms can be sporadic, flaring up only during certain times or after exposure to specific triggers. They can be mild one moment and severe the next. That's the unpredictable nature of asthma. Recognizing these symptoms is a key step towards diagnosis. But how do doctors diagnose asthma? We'll delve into that in our next segment, so stay tuned. Diagnosing asthma involves a few different steps. It's not as simple as a single test or a quick glance at your symptoms. Instead, it takes a comprehensive approach that combines different methods to ensure an accurate diagnosis. One of the primary methods used is spirometry. In this test, you'll be asked to breathe into a device called a spirometer, which measures how much air you can breathe in and out, as well as how quickly you can exhale. This helps doctors identify any obstruction in your airways that could indicate asthma. But spirometry alone isn't enough. Your doctor will also review your medical history, paying close attention to any past respiratory issues or allergies. They'll ask about your symptoms, such as how often they occur, their severity, and any specific triggers you've noticed. They might even ask about your family history, as asthma can run in families. Now, it's important to remember that only a healthcare professional can diagnose asthma. So, if you're experiencing symptoms, it's crucial to seek medical attention. Don't try to self-diagnose or ignore your symptoms, as this could lead to complications down the line. And here's why early diagnosis is so vital. The sooner asthma is diagnosed, the sooner you can start managing it. This might involve lifestyle changes, medication, or a combination of both. And remember, asthma is a chronic condition. So, while it can't be cured, it can be managed effectively with the right care and treatment. But what if you're diagnosed with asthma and you're feeling overwhelmed? Don't worry. There are plenty of resources and support systems out there, from asthma education programs to support groups. And of course, your healthcare team will be there to guide you every step of the way. Asthma might seem daunting, especially if you've just been diagnosed. But it's important to remember that with the right diagnosis and treatment, you can live a full, active life. So don't let asthma hold you back. Take that first step towards diagnosis and start your journey towards better health. Diagnosis is the first step towards management and control of asthma. It's the beginning of your path to understanding your body better and taking charge of your health. So don't delay. Take that step today. Are you finding this video useful? If so, please consider subscribing and giving it a thumbs up. It's a simple action on your part, but it makes a world of difference to us. Your support enables us to continue providing you with valuable content like this, helping to demystify complex health issues. Remember, every like, every share, every subscription fuels our efforts. We truly appreciate your engagement and encouragement. Stay tuned as we summarize the key points from our discussion. Let's recap on what we've learned about asthma today. Asthma is a chronic condition affecting the airways of the lungs, which can cause breathlessness, coughing, and wheezing. It's a complex condition with multiple causes, and understanding these can help us manage the symptoms more effectively. Asthma can be caused by a combination of genetic and environmental factors. Some people may be genetically predisposed to asthma, while others might develop it due to exposure to certain allergens or irritants. Environmental triggers such as smoke, dust, and pollen can lead to asthma flare-ups, while strenuous exercise, cold air, and strong emotions can also provoke an asthma attack. The symptoms of asthma can range from mild to severe and can occur daily or only occasionally. Common symptoms include shortness of breath, chest tightness, and coughing, especially at night or early in the morning. The severity and frequency of these symptoms can vary widely from person to person, and they can sometimes be mistaken for other conditions, which is why it's so important to seek professional medical advice if you're experiencing these symptoms. Diagnosing asthma involves a thorough review of your medical history and a physical examination. Doctors often use a spirometry test, which measures how much air you can breathe out in 1 second, to help diagnose the condition. Early diagnosis is crucial, as it allows for prompt treatment and management of the condition, reducing the risk of severe asthma attacks. In conclusion, asthma is a multifaceted condition with various causes and symptoms, and its diagnosis requires a comprehensive medical evaluation. It's important to remember that while asthma can be a challenging condition to live with the right knowledge and medical support, it can be effectively managed. Remember, understanding asthma is the first step towards managing it. Thank you for watching.